Hi, my name is Stacy Thomas, and I'll be presenting on Chapter 6 in the Order to Care book by Susan M. Reverby. Chapter 6 is titled Nursing as Work Divisions in the Occupation. The subtitles are Independence and Ambiguity in the Private Duty, The Limits of Other Opportunities, Professional Life Tables and Choices, and A Divided Home. In the early 1900s, trained nurses competed against the untrained for the same jobs. Most students left the hospital behind after graduation, unwanted by institutions, which were staffed primarily by the untrained or student nurses. Graduates were expected to find work in competition with untrained in the private duty market. There were few positions in nursing at this time that required training. In the 1930s, there were more positions that required education, but there were still a majority that required no education. As with all working women at this time, choice and independence were relative commodities. Independence in ambiguity in private care. Most graduate nurses went to work in private homes. Hospital setting was for nursing students and untrained nurses. Private duty expected nurses to be submissive to higher authority. The nurse was working for the doctor's patient. Dangers of private care. Exhaustion. The average nurse worked 84 to 168 hours per week, sometimes pulling 24-hour shifts. There's a shortage of supplies. They didn't have a lot of supplies at the home. It wasn't like as if they were in a hospital, so they had to make do with what they had. There was lack of supervision, so it was easy for nurses who weren't very confident in their skills or weren't very good nurses to hide in private care because they were never checked on. And also they were treated like servants in some homes. They were asked to do too much. They sat in the kitchen for meals with the servants instead of at the table, and their duties and roles were very clouded. In the late 1800s and early 1900s, nurses were facing unemployment and having difficulty finding work. After World War I, a shift in the middle and upper class using hospitals also caused a shift in the nursing roles and opportunities. Private duty nursing also began to decline due to advances in medical care and less illness among citizens. The limits of other opportunities. The training school attended by the nurse affected the type of job the nurse was able to obtain. If you went to a more prestigious school, you were offered more supervisory roles and things like that. If you didn't, you were more of the lower level, low paid jobs. Job requirements and pay were very different. In the 1880 to 1890s, superintendent salaries ranged from $900 to $2,000 a year. In 1916, a superintendent nurse of a small hospital made between $600 and $1,200 a month, and they would be on call for 24 hours. In a larger hospital, however, they would make more money, $1,000 to $2,000 a year, and they would be expected to do 12-hour shifts and work 6.5 days per week. Young nurses in supervisor roles in hospitals. Due to the lack of stability of jobs, a lot of nurses moved jobs very frequently. It was hard to keep a nurse in a job for a long time. Staff nursing was not desirable to the trained nurse. Hospitals did not want to hire graduates. They wanted the untrained nurses and students. It was seen they could offer them less pay, and it was seemed that physicians and other nurses in the hospitals thought that nurses who graduated from programs seemed to question authority more, so they didn't want them in hospitals. Public health jobs at this time were limited. Public health wasn't really established until the 1930s. In 1912, there were 3,000 public health jobs. In 1938, there were 19,390 jobs. These jobs included department stores, industries, insurance companies, the Board of Health, Education, hospitals, settlement houses, and a lot of other opportunities that before 1938, nurses didn't have. Professional life tables and choices. Personal inclinations, skill, luck, and opportunity shaped work patterns. Age, marital status, family demands, training, school, and year of graduation determined work histories and affected positions offered. At this time, there was very little upward movement for nurses. There's a lot of horizontal movement, kind of moving from the same type of job, just maybe at a different facility. In 1912, the American Journal of Medicine was quoted for saying that nursing required the young and vigorous who could bend to the strains and not break. Physicians and patients expected young, pretty nurses because they thought it would affect or have an effect on better care. Marriage, if a nurse got married, it could mean that they dropped out of the workforce. Women nurses between 1873 and 1940 had a very high percent of nurses who never married. Family demands, even if nurses didn't marry, if a family member was sick at this time, they were expected to take care of that family member, even if that meant quitting the job that they had. And then obviously if they had children of their own at this time, a lot of women didn't continue working. And then, as said before, better schools offered better positions. So nurses who went to the more prestigious schools were offered better positions. At this time, nurses as a whole moved a great deal between jobs, cases, practice fields, and location. A divided home. At this time, nursing was seen as subordinate in labor. It was dominated by males, being the physicians. Skills to provide a lifelong career is what nursing offered. It also offered the opportunity for adventure and geographical freedom. But at this point, too, in the early 1900s, nursing was starting to get overcrowded. The 1890s, it was a financially unsecure and overcrowded field. This caused bitterness and more horizontal shifting of work. So as we talked about before, kind of the instability of hospitals and nurses in the supervisor positions there moving very frequently. The overcrowding, bitterness, the low job opportunities, this all helped shape the politics of the nursing reform that we're going to see later. This is the end of my presentation. I hope you enjoyed.